Monday morning, welcome back to the program. We're almost into winter. It's the 30th day of May today. Marcus Paul in the morning. Please give us a like and follow on all of our social media platforms. The new YouTube channel as well is up, and I'm recording this and it'll be up a little later today. Quick question. Have you ever ridden in an ambulance? I have, but many, many years ago when I was a young fella, I had an accident on my bike in Western Sydney and ended up having a plate inserted into my arm here. It was very painful. But I was out of it. I was in so much pain. I don't recall the trip to hospital via the ambulance. But over the weekend, I read that ambulance response times will cost lives, according to a new survey of paramedics, in particular in New South Wales. Look, ambulance ramping, that's a situation where, emergency departments are so full that ambulance crews are stuck basically in the driveway of emergency departments looking after patients because they can't get them into triage, of course. And it's a problem right across the country, but 90% of paramedics believe the current crisis in the New South Wales ambulance network is leading to patient deaths due to longer response times and, well, staff being completely and utterly overstretched. 9 out of 10 New South Wales paramedics believe the current crisis in the New South Wales ambulance network is leading to patient deaths. I mean, that surely is something that should be of great concern to the New South Wales Premier, Dominic Perrottet, and of course the Health Minister, Brad Hazzard. A survey conducted of more than 700 paramedics, so it's a pretty decent sample size. It was conducted by the Australian Paramedics Association, also found that 40% believe their patients had suffered worse outcomes due to extended response times in the past month or so. The APA, the Australian Paramedics Association's Gary Wilson, is their secretary. He said the state's ambulance network has now hit status 3, its highest emergency response level. And it reaches this response level regularly as paramedics attempted to respond to increasing demands on the overstretched network. Now, I heard that New South Wales ambos in particular have not been this busy in their entire history. Now, Mr. Wilson said we have the worst response time in history, worse than any other state, and delays in response times leads to deaths. If you look at defibrillation, for every minute we delay defibrillating someone who needs it, their survival rate drops by 10%. So a 3-minute increase in response times, that's 3 minutes, there'll be a 30% drop in a patient's survival rate. I mean, when you bring it down to sheer numbers like that, it's a little scary. Now, over the past 2 weeks, News Corp's Sunday Telegraph has documented hundreds of ambulances ramp for hours at multiple metropolitan hospitals awaiting admission. Ramping due to bed block prevents paramedics from responding to calls as they tend to patients outside emergency departments. I mean, basically, they're stuck there with their patient in the back of the ambo because they can't get them into triage, into the emergency departments. Now, on Thursday of last week, there were zilch, no ambos available in the Illawarra, the Central Coast, or Newcastle, and only 8 free in the entire city of Sydney, a city of 5.5 million people. Industrial action by the APA paramedics over the weekend included not taking billing details from patients in protest of this ongoing crisis. Mr. Wilson said we see it day after day. We have photos of hospitals stuck in bed block for hours on end. 1 in 3 paramedics in this survey reported they had spent between 4 and 6 hours ramped, 4 and 6 hours. That's outside hospitals facing bed block, and 55% reported they had been ramped for between 2 and 4 hours as the state's hospitals struggle to cope with COVID cases, soaring cases of influenza, furloughed staff, and overwhelmed emergency departments. Now, this survey also revealed 67% of paramedics had done forced end of shift overtime in the past month. The system is under-resourced, and these statistics reinforce what they've told the government, that they are in New South Wales some 1,500 paramedics behind Queensland and Victoria on a per capita basis, and they're struggling with the ongoing workload. The system is buckling, and the only thing that's kept it afloat is that paramedics are breaking themselves to look after the community. Alarmingly, as well, 3/4 of paramedics reported feeling too tired to drive home safely after work. Figures released in March of this year showed New South Wales Ambulance had the highest amount of responses in the quarter since 2010, with 320,729 ambulance responses and almost 9,000 priority cases. Patients with life-threatening conditions were up 32.9% compared to the same period back in 2019. Meanwhile, the Bureau of Health Information quarterly report from March showed the service had hit a 5-year low in response times. A spokeswoman for New South Wales Ambos said the high number of COVID cases had impacted New South Wales Ambulance in a number of ways, including an increase in transport need for cases and staff furloughed due to contracting the virus themselves. Already this year, more than 300 new paramedics have been deployed across the state. That's according to the state government, but they say the Omicron-related COVID-19 and recent influenza demand is on top of the normal paramedic workload in the community, which is now largely returned to pre-pandemic life, with an increase in car accidents, assaults, falls and other activity-related call-outs. It's a mess, and it's something the New South Wales government needs to get a hold of as quickly as possible. Marcus Paul in the morning.